Phil McCarvill, who's from the NHS Confederation. They represent health trusts in the country, and then I'm going to hear from the opposition spokesman on the matter in a moment. But Phil, first of all, what's going on here?
Well, I think it's very clear that these are very challenging times. A recent survey of our members, which includes NHS Foundation trusts and acute providers of hospital care, but also other parts of the NHS, said that 72% thought it was the worst ever financial situation they'd faced, and that the
parts of the health service, can you?
Well, I think it's one of the challenges. There's the short-term pressure over delivering more for more people in a financially strained times, but also it's about thinking about how you transform that care so that we're not in this position in the future. I mean, what's really interesting is that these are the first quarter figures and the first quarter of 20 quarters over the lifetime of the Parliament, so there's a real opportunity to do something different. But it's how do we create the space for local decision makers, local commissioners and local providers of NHS services working with social care and local government to really transform the care so that we are producing a more sustainable health and social care system.
And efficient, but that efficient, even becoming more efficient, takes time. In the meantime, we've got to stagger through the winter, and it does look difficult.
It does. And as I say, the twin pressures are how do we ensure that we maintain the quality which our members are striving to do, but also then at the same time developing the relationships which many of them are doing at the moment to actually look at how you deliver care better in the future.
In the short term, there's going to have to be more money found, isn't it? Or some dramatic cuts. What else do you do?
Well, the pressures are, I think it's really important to look at the wider system. So what we're calling for is greater certainty. What our acute members and other NHS provider members don't have is certainty about the future. We're not sure what money is going to be available in the 6 months' time, and actually multi-year funding of services and multi-year budgets would actually be a real step forward, and that's why we're calling as part of the spending review for certainty, not only about the health service budget, but also about social care, so that we can plan and have a sustainable health and social care system going forward.
Phil McCarvill, thank you. Heidi Alexander is Shadow Health Secretary. Good afternoon, Heidi.
Hello, Peter.
Well, it's a problem.
It is indeed.
So what do you say we should do about it?
Well, I think what I'd like to say to start off with is that I think these reports confirm what many of us have feared for a very long time, and that is that NHS finances are in a very dire and desperate state. And I think the government need to get their head out of the sand, quite frankly, and set out very clearly what they're going to do about it. One of the reports which has been made public today is the report which has been done by Monitor, which is the body which oversees hospitals which are foundation trusts. And they very clearly state in their report that one of the primary drivers of this deficit is the over-reliance on expensive agency staff. At the beginning of the last Parliament, we saw the government cut nurse training places, and this is putting huge pressure upon the budgets of hospitals at the moment.
Well, yeah, if they cut, they cut. I doubt if the pressure on the hospital at the moment is directly responsibility of those cuts, though, is it? I mean, we do have a staffing problem here. I mean, doctors take years to train, for instance, and the locums who are being hired are costing a fortune. This is not something which has happened overnight, something which is built up over years.
Well, I think that if the last government, the coalition government, had kept the nurse training places at the level of the last Labour government, we would have actually seen 8,000 more nurses employed permanently in the NHS. Instead, they're having to take on expensive agency staff, and that is very clearly stated in the Monitor report that we've seen today.
So what would you do now if you were back in power?
Well, I think that Jeremy Hunt needs to find money now to put in the NHS to get us through the winter crisis. At the last election, we said that we would have had an emergency budget to tackle this problem. We also set out very clearly the measures we would have taken to recruit